I'm here with Dr. Matt Hall from UConn Health. So you train the Huskies and you're working with elite college athletes, but you also have the weekend warrior types that come into your practice. What would you say is the main difference between the two?
Well, I think their problems are basically the same. So if you take an example of patellar tendonitis, whether you're taking care of a high-level athlete or somebody that's running on the weekends, it's the same problem. The treatment's essentially the same, but they just have better access to care. They have better resources. They have more ability to get into physical therapy, which a regular person might only be able to go once or twice a week, where our student athletes have access to somebody, 7 days a week to help them get back to what they were doing before.
What are some of the tools that help you diagnose injuries?
Well, first and foremost, you got to get a good history and physical. I mean, that's number one. And then we use a lot of imaging studies to try to help us figure out what's going on. But we don't treat imaging studies. We treat patients. So usually we get an X-ray, which gives us a lot of information, not just if they have a broken bone or something that needs to be fixed. Then I use a lot of ultrasound in my office. So if I see somebody again with patellar tendonitis, I can see them, take a look at the tendon, and then figure out how that is going to fix my treatment or change my treatment. And then we use, obviously, MRI is a great tool because ultrasound can't see deep in a joint. So that's really good at looking inside of a joint for an intra-articular problem or something that might require surgical treatment. So we have a lot of tools at our disposal, but ultimately, we got to use the tools to help us sort out what our history and physical is telling us.
Now, if somebody does get injured, where should they go to get help?
Well, at UConn Health, as part of the orthopedic department, we have doctors that basically can take care of all orthopedic problems. We have offices at the main hub, obviously in Farmington, but satellite offices across the street here in Storrs Center, as well as in Southington and Avon. So we can take care of all your problems.
All right, Dr. Matt Hall, thanks so much.
Thank you.
All right.